No, no, just open it. Open it.
Yeah.
Give it to me.
We're rolling.
This is a very distinct pleasure for me. I want to introduce my son, Dane Thomas, who currently lives in Stockholm, Sweden. And everybody knows John Hamilton, but what very few people know is that Dane and John went to high school together in a little high school down in Modesto, actually in Ceres, but it's called Modesto Adventist Academy. And I'm very pleased to be sitting here in the company of two entrepreneurs that I'm very proud of my son and very proud that I have known John Hamilton for a long time. So Dane, can you tell us what you're doing here?
Well, I'm here for my 30-year high school class reunion. I graduated in 1982.
You can't be that old.
Yeah, well, that's the way it happens, if you're lucky. John graduated a year ahead of me, but we were at the school. It was called Modesto Adventist Academy at that time. Very small school, maybe 160 people max.
Yeah,
It's been
huge.
less than that since then. But we were both there at the same time, and a number of activities and classes cross paths quite often.
Oh yeah. Well, you can't help it in a school that size.
No, you're tripping over each other all the time. But, the school's switched names now. It's Central Valley Christian Academy now, but it's in the same location, well, almost the same location. But be down there for our Alumni Day, Saturday the 21st. I'm looking forward to that.
Now, question. I mean, this is. How is it being an expat? I mean, because you've lived overseas for how long now?
We moved to Stockholm 14 years ago.
Okay.
Summer 1998.
Yeah.
And been there since then. And get the opportunity to travel back to the States probably an average of every year for me. My wife's over a lot more often. She's Swedish, but she's more homesick for the United States than I am sometimes. So she's been over twice already this year, to Phoenix and to Boston. But
I think you're in an interesting spot there to where you get to see how an accurate view of how the U.S. is actually viewed on the world stage. I mean, maybe that's kind of an odd question, but I mean,
no, not at all. Not at all. I think that it's my impression and the impression of many that I interact with in the Stockholm region anyway, that you get a one-dimensional view of your own country if you only look at your own country's news reporting.
Right.
So if you're in England and all you watch is the BBC, well, then you get a kind of a skewed view of England. If you have an opportunity to look and see what CNN says about England and what Al Jazeera says about England, or what the German networks are saying about England, well, then maybe you'll get a little bit more nuanced and faceted view of what's happening. And I think the same thing can be said for the United States as well. And so if all you watch is CNN about domestic news items,
Right.
well, you're limited in your potential viewpoint there.
So do you think I'm probably accurate? Because I like the UK papers' take on the U.S. much better than I like our domestic take. I mean, if I want to, even on our political stories or anything else, if I want to try to get what I think is is a good view, I usually go to most of the UK papers, and
I think there's an opportunity to get a balanced viewpoint,
yeah,
and from a media that doesn't necessarily have a dog in the race,
Right.
Not pushing a specific agenda one way or the other. Doesn't really matter. But
I didn't want to skew this little thing, but is there a perception overseas that there is still the expectation that the U.S. needs to do well on a world stage?
of course,
Is that still an expectation that we have to do well as a country for everybody else to?
there's a pragmatic and a realistic viewpoint that the health of the United States economy is a very strong, not just an indicator, but a prime mover in the health of the world economy. And things go bad here, things go bad everywhere. That doesn't mean that there aren't points of focus outside of the United States. There are obviously, you'd like to see economic development going well in as many places as possible. And it's not a zero-sum game in that the health of one place equals a downslide in some other place either. I think that there are points of vulnerability in many different places worldwide, and that the U.S. is the biggest point of vulnerability.
I saw something that was sobering. I don't know if they brought this up overseas, but they all the talk about the EU, the EU and the debt crisis in the EU and the Spains and the Greeces of the world.
Greece and Ireland, yeah.
But the based on population of the U.S. and actual per capita debt and everything else, technically we are worse off than Europe. And I thought that was a staggering. It's an interesting thing where if you look at debt per capita and everything else, per population, we're actually worse off.
Debt per capita, you'd need to have a very broad viewpoint to make any meaningful comparisons there, of course. But and worse off, better off. Does it feel worse off? What are the unemployment ratings? I mean, Spain is dying there. The U.S. There are parts of the U.S. that are really dying. There are parts of the U.S. that are okay. There are a lot of things to take into consideration when you look at that. But overall debt ratios and things like that, America's not in particularly good shape. And expatriate, it doesn't mean I'm not caring about what's happening. Definitely, I want it to go as well as possible, and it is very discouraging when you see such things. But one of the things that I mentioned that my wife is over quite often, and she works in a field where she gets the opportunity to lecture worldwide and come into contact with people from a lot of different places. And one of the things that she's noticed that I think that there's very little to say against is that the U.S. has they're probably some of the best in the world as far as fixing things when they're broken. But there is quite a bit of a crisis mentality that we're going to send a team in and fix something. We're going to we have the best fire department in the world, but as far as preventing fires from happening in the first place,
so much.
maybe not so much. And she works primarily in prevention, and so she's kind of hitting her head up against a wall when she comes to the United States. The people in the other countries are interested, and they're very appreciative of what she's doing and want to be involved with it. And some in the United States are also willing to recognize this. And I think I learned this saying in the United States that an ounce of prevention is worth a pound of cure.
Right.
But we're not seeing a lot of that. We're seeing a lot of people looking for pounds of cure, but not a lot of people willing to invest in that ounce of prevention. It makes it a very uphill battle for her, because the people who would want to implement it see the value of what she's doing, but the funding is only available for fixing things that are already broken. It's not available for preventing them from going bad in the first place. And I think that is key in bringing America out of the economic doldrums that they found themselves in.
Now, you worked in IT for, when you moved over, you were medical IT? Is that?
Well, when I was working in the United States, the 10 years before we moved, I was a physical therapist. So I was involved in direct patient care, physical therapy background. When I got to Sweden, worked in sports medicine research for a while, and then I got recruited to come in as an IT coordinator at a children's hospital.
Got it.
And so I worked in various IT capacities of support and helping with the IT delivery at Stockholm County, which were responsible for 3 or 4 different hospitals, 20,000 employees. Huge operation there. The primary healthcare deliverers for the Stockholm region, which is 2 million metropolitan region. And so I have 10 years of experience in direct patient care here, 10 years of experience with delivery of patient care and support systems in the socialized medicine realm. And so I think I've got a pretty good balanced background on the pros and cons of both systems. And there are pros and there are cons in both systems. And so it's always amazing to see the lack of nuance and perspective in the debates that occur over here. It's very hair-trigger reactions. We're just going to throw out that entire idea because there's one little bit of it that we don't like. And there are other 8 bits that we don't necessarily understand, but it can't be good because there's one bit there that we don't like. And I think that's unfortunate, because the population deserves the best possible.
Isn't it, not to oversimplify things at all, but it was interesting, as we were, years ago, I was having a long conversation on this topic with a physician we both know, that in his estimation, where the U.S. healthcare system went off the rails was in the late 70s, when the real disconnect happened between third-party pay. Where basically right now what is billed in the U.S. has no relation to what will actually get paid to the physician. I mean, there's the disconnect. I mean, the actual even what is invoiced is based on who might or might not be paying or where. I mean, there's no.
Exactly.
I mean, it's completely blown up.
Well, back in the 90s, the mid-90s, when I was involved in a restructuring of the physical therapy clinic where I was working, this was in Colorado, at the Stedman Hawkins Clinic there, but we were delivering physical therapy care for them, and they had a huge proportion compared to normal clinics of out-of-state, out-of-country patients coming in, people who had injured themselves at Vail, or people who had injured themselves elsewhere and were coming there just to get surgery, and so you think that's a pretty cream of the crop clientele to be having, and it was. But when we looked at actually what we were billing, what we were providing, the value of what we were providing, and how hard it was to collect on what we were billing, it was pretty evident that we were having, our total invoices were about 3 times what our necessary cost would have been.
Right.
That is to say, if we were getting paid cash on the barrelhead for every patient care delivery hour that we were doing, that we could have chopped our prices at 1/3, and those who were involved in the delivery of the direct care would have still been getting paid an equivalent amount. We would have had fewer jobs we were creating because we wouldn't have needed all the office personnel.
Yeah.
But by getting rid of the uncertainty moment of, well, we're delivering now, when are we going to get paid? Are we going to get paid? How many different hoops are we going to have to jump through to get paid? It would have made our operations much more efficient.
Yeah.
And that's one of the things that when I looked at the way patient care is being delivered in the organizations that I've been involved with in Sweden, is there's never any uncertainty about whether or not you're going to get paid.
Right.
You always know you're going to get paid. And because of that, you can operate more efficiently. You can deliver more hours, more treatments of patient care at a lower cost, and spend less time chasing payments for things that you did 6 months ago.
Yeah, I mean, there is the expectation in the U.S. where providers, by necessity, throw everything at the wall, just hoping something sticks.
Hoping you're going to get something.
Yeah.
And if you're in an emergent care type of a situation, you've got to provide a certain level of care to everyone who comes in, regardless of their ability to pay, because you got into patient care because you like to help people. You didn't get into patient care because you wanted to be a policeman and say, no, I'm not going to fix you. Yeah, I know you're bleeding. Get out of here. You can't pay. You're going to treat these people anyway. So you get people who can't pay who get treated anyway. And who pays for that? You do.
Right.
And I don't, but because I don't live here. But everyone else who's paying into that system ends up having to, a potential payee into it, pays for everybody else and subsidizes everybody else who doesn't.
I think I hijacked your dad's interview.
I'm gonna run out of takes. But I'm certainly not advocating any one specific plan for how to address this.
Right.
Just that you need to have an open mind and be aware. If there's somewhere else where it's being done more efficiently, look at that. Maybe try to learn from it.
Yeah.
Let me jump in here for a second. That 1/3 of the cost, or the 1/3 of the billable receipt is what it can be done for. Years ago, when I had a hernia repair, I just asked, what would it cost me to get this done if I was going to bring in cash to get it done? And they said, oh, if you're going to bring cash, we could do it for $2,000. But they ended up billing the insurance company $6,000 for the same procedure.
There you go. That's not just a number we plucked out of thin air. I think you're going to see that across the board if you ask and you have a medical provider of many different kinds. Exactly. If you could provide all your patient care that you deliver and get paid for it immediately, and you didn't have to hire an entire staff of billing people or be a part of a big group because they have the staff of billing people and you've got the facilities there. Could you do it more efficiently? Of course you could do it more efficiently. There's no doubt about it.
The interesting thing where what came out of the conversation were long conversations, because I actually, before I started this, I was VP sales for a medical software company. It was but anything of how this came out was from talking to those physicians. What says best case scenario, how would you fix the U.S. healthcare system? And I thought it was fascinating. Is if you look at Walmart now is implementing where with Procter & Gamble and others to where there's nobody there, to where the system tracks inventory. It orders, the system orders more product when they're low on product and everything else. Checks are issued with nobody there. Checks are issued based, and the thing was switch medicine with the insurance departments over to something similar to where everything gets, sit down once a year, you agree on pay rates and things like that, and then for routine stuff, it just gets done. It just gets paid, and then, because for example, Procter and Gamble and Walmart sit down like periodically and say, okay, what do we need to fine tune on this? How much is falling through the cracks and everything else? Because right now in medicine, you end up with billing departments warring against billing departments, and how much of medicine's cost is just the operation of the billing departments. It's insane.
There's so many built-in inefficiencies, and as long as you have so many of the stakeholders who are dependent, their jobs and livelihoods are dependent upon being a part of that inefficiency, it's not going to get changed.
Sounds almost government-esque.
Yeah.
Anyway, all right.
Well, how does it feel living in a socialistic society, Dane?
Socialist. That's a misconception, because if you look at the history of socialism, social democracy, communism, and all of these, they all get thrown into the same bucket, but it's not the same thing at all. Even the man who was in charge, the Prime Minister of Sweden for 6-8 years, Göran Persson, when the financial crisis hit, he was out and saying, Sweden, we're a social democracy, but essentially we're a capitalistic economy. And it's a capitalistic economy, and we are part of this same system, and we need to act in concert with the rest of this to do our part of making it be reducing the pain for everybody, and helping the rest of the world out of this as well. They're playing a part of that, and if the primary the Prime Minister on the left side is touting the fact that we are a capitalistic economy over there, they can't be lumped in with North Korea or Cuba. It's not the same type of thing. So,
you mentioned a moment ago that Stockholm has a population of 2 million people.
2 million in all of the surrounding counties in that. Yeah.
I never really thought about Mogadishu as the same population, and whereas you had 20,000 people working in one aspect of healthcare delivery, I think that the people involved in healthcare delivery in Mogadishu, Somalia, might be 200 or 2,000, certainly not more than that. But
probably no difference in quality of care either, right?
No, not at all. So, anyway, this has really been fun listening to you guys.
Well, we could have, Russ has another child, Amanda, my sister, and one of her first jobs that she ever had was working for John.
Ah, that's for ages ago.
Ages ago. So we have even more connection than that. I'll be seeing her in just 3 days. So,
ages and ages ago.
What was her job working for?
Probably at the yogurt shop.
It was at the yogurt
bar.
bar.
Yogurt shop. Okay.
Yeah.
All right.
Providing high quality nutritional.
Yeah. So 30 years for you. Wow.
30 years.
So.
I need to remind you of something.
Yes.
Back when you had the yogurt shop, you had the barnyard freeze,
yes.
the mix of chocolate
yes.
and vanilla. And I told you back then that you needed to make a cookie dough flavor, and you
That's
said,
true.
"No, nobody's going to want cookie dough."
They do like.
How does Ben and Jerry's do with their cookie dough?
Very well.
You could have been ahead of the curve on it.
Yes, very well. Yeah.
Would you say that Sweden is a capitalistic country with socialistic care programs for its people?
I would say, well, they're definitely a capitalistic economy.
Mm-hmm.
There are things that the Swedish government has agreed upon, and the Swedish government, the people have agreed upon that they want. They want a bigger safety net than what the U.S. is comfortable with. They want to make sure that healthcare is provided for, free healthcare for all kids. And in the U.S., we got Medicare, and we accept the idea that healthcare is subsidized and taken care of for people who are 65 or over. But over there, they say, well, let's do the same thing for everybody all the way through.
Your comment was very enlightening to me, because I've noticed just recently went on Medicare. Okay.
And Ed Nyman is off camera, and you'll hear off camera.
I get better care from the doctor